Hello, and welcome to this short clinical refresher about feline hyperthyroidism as part of the Make Senior Easier materials. Hyperthyroidism is one of those conditions that genuinely emerged as a new disease in cats in the 1970s, rather than being a previously undiagnosed one. Throughout the 80s, many advances were made in diagnosis and treatment of the condition before radioactive iodine treatment was developed as an entirely new approach. It wasn't until the 90s, though, that management of these conditions became mainstream in first opinion veterinary practice. The last decade has seen hyperthyroidism in cats become the most common endocrine disorder of cats, even above diabetes. The underlying etiology of hyperthyroidism in cats is still not fully understood, but we do know that the causative pathology in the vast majority of cases is benign adenoma. Hyperplastic thyroid tissue causes gland enlargement and excessive production of the thyroid hormones, which are of course instrumental in controlling metabolism. This excess of thyroid hormones increases the basal metabolic rate in affected cats, which is why we see the typical clinical signs listed here. In practice, we often see the scruffy-looking, skinny, vocal and sometimes angry hyperthyroid cat. Other conditions can mirror many of those clinical signs, and particularly in the case of chronic kidney disease, can exist as a comorbidity in hyperthyroid cats. It has been shown that up to 40% of hyperthyroid cats have renal disease at presentation, so it's really not uncommon. While the history and clinical exam might give you a strong suspicion of hyperthyroidism, absolute diagnosis relies on demonstration of elevated plasma total T4 levels. I've already mentioned chronic kidney disease as a potential comorbidity, but hypertension and cardiac abnormalities are also commonly present in hyperthyroid cats. Some estimates state that nearly a quarter are already hypertensive at diagnosis, and another quarter develop high blood pressure once their hyperthyroidism is controlled. This is why ongoing blood pressure management in hyperthyroid cats is important, not just at diagnosis, but throughout treatment. The same is true for renal parameters, perhaps even more so, as the raised cardiac output as a result of hyperthyroidism often compensates for renal insufficiency. Once the hyperthyroidism is controlled, the extent of renal disease becomes apparent. Around 30% of hyperthyroid cats become azetemic once hyperthyroidism therapy is started. And finally, the heart can be under real strain in hyperthyroid cats. The elevated levels of thyroid hormones not only directly affect the cardiac muscle, but indirect effects on the adrenergic nervous system and compensatory mechanisms for altered tissue perfusion put extra pressure on the cardiac system. Abnormalities may manifest as murmurs, arrhythmias, ECG abnormalities, or structural changes on radiography and echocardiogram. It's worth noting that cardiac changes may not be reversible, even if the hyperthyroidism is brought under control. Treatment is primarily aimed at achieving normal thyroid hormone levels and consequently managing the associated clinical signs. Equally important is managing any comorbidities, so it's worth preparing owners from the onset for some degree of ongoing monitoring, whichever method of hyperthyroidism management they opt for. Currently, there are 4 main treatment or management options. The first is surgical removal of the affected gland or glands. This is a relatively straightforward procedure with good success rates. However, some patients, especially as they're often elderly, are poor candidates for the general anaesthesia. There's also the risk of specific post-operative complications, such as unintentional damage to the parathyroid glands, or procedure failure if either ectopic tissue is present or if unilateral disease progresses to bilateral disease. Irradiation is considered by most to be the gold standard treatment option, as it's curative with very low risk of iatrogenic parathyroid damage, and it doesn't require general anaesthetic. It's not suitable for some cases, however, due to the requirement of the cat to stay within the referral setting for at least a week or but up to 4 weeks, with some restrictions once discharged home for safety reasons. Although the overall treatment cost isn't actually always vastly different between curative and management options, the upfront costs of options like irradiation and surgery can be prohibitive for some owners. Nutritional management is the newest option available, with varying reports of success. It offers a relatively cost-effective and convenient option for owners, as they would be feeding their cats anyway. Problems can arise, however, if the cat has any opportunity to get food elsewhere, or if they simply won't eat it. Medical management of feline hyperthyroidism is the preferred option for the majority of UK vets and is successful in most cases. The drugs work by inhibiting the enzyme that transforms the thyroid hormone precursor. There are well-established protocols for these drugs that allow titration to effect, and they can be used as a way to stabilise patients before surgery or for long-term management. Successful medical management obviously relies on owners being able to administer the medication to their cats every day, but with both tablets and more recently liquid formulations available, most can achieve this. Any side effects are usually mild and transient, but can be completely reversed by stopping the medication if needed. With medical management, most cats require an initial stabilisation phase following diagnosis, with dose adjustment to achieve thyroid hormone levels that sit comfortably within the reference range. And this period should be run on a 3-week recheck cycle, and once a stable state of euthyroidism is achieved, checks can frequently be reduced to every 3, then every 6 months. But don't forget the importance of ongoing monitoring for those comorbidities at rechecks as well. Another important point for ongoing management is making sure everyone works together to keep stress levels down for the hypothyroid cat. One good reason is that stress can exacerbate clinical signs, and the second is that these cats will require revisits. So you want to make each experience as positive as you can to prevent future learned behavioural problems. This can be achieved by applying cat-friendly physical and handling features in the clinic setting and advising owners about how to travel their cat in the least stressful way. Keeping things stress-free is one thing that Animalcare was designed for. Containing the trusted active ingredient thiamazole in a double concentrate liquid formulation, it offers the lowest dose volume option for effective medical management of feline hypothyroidism. It's been shown that liquid formulations are the preferred option for owners and for cats, so a double compliance win. This short CPD is part of a whole suite of materials designed to make senior easier for older pets. And visit the PAC website for the full range.